name's Ben Carroll. I'm doing the Level 3 Allied Health Apprenticeship, and I work in occupational therapy.
Okay. And could you tell me a little bit about, like, what are your day-to-day duties? What's your job role? Sort of what does that generally entail?
So I support the occupational and physiotherapists. I work in geriatrics most of the time, which is care of elderly patients, but then I also support in A&E acute medical units, and sometimes stroke if they need a hand over there. Mainly work in rehabilitation of patients in acute hospital. Discharge planning comes a lot into it, so sorting out things for when they get home. I deal with equipment needs as well. And then occasionally safeguarding, we have some involvement in that as well.
Okay, it's really interesting. And can you talk to me a bit about, like, why did you choose that career path?
To be honest, going into this, I knew that I wanted to progress and to do something in healthcare. I was kind of drawn between nursing and occupational therapy, but then I did a lot more reading into occupational therapy and saw what their role was, and it seemed to fit with the skills that I think I have and the interests that I have. I previously worked in a spinal cord injury charity, so I was aware of stroke patients and people that have traumatic brain injuries, so I thought that this would be a good way for me to put that knowledge to use. And yes, in starting, I've just really enjoyed it, so I'm looking forward to progressing now.
That's really interesting. What was it like to work in that spinal cord injury unit?
Yeah, no, it was good. I wasn't obviously very hands-on because I didn't have training, but I would attend a lot of their seminars and things and their open days and go and support there. And that's just kind of really what sparked my interest. And then I think from there, I met a few occupational therapists while I was there that I spoke to, so that was kind of all I needed to confirm that I wanted to do this.
It's really cool. And what about the apprenticeship itself? How did you get into that?
That was kind of from the get-go. When I interviewed for the post that I'm in now, when they said at the end, do you have any questions? I said, are you willing to put me through an apprenticeship degree? So they kind of talked me through what the process would have to be for that. So I think a few months after I started working here, I enrolled into Dynamic.
That's really cool. Okay, so it was like basically as soon as you joined the job,
Yeah,
they were
pretty
getting
much.
you into that training sort of as part of the entry to it. It's really interesting. And in terms of like your relationship with your coach on the actual apprenticeship, what's that been like? How have they supported you?
No, so I work with Kate Richards. She's been really, really good. She is there when you need her, but she's not overbearing, which is sometimes what you would experience in colleges. I've found. I worked at a previous apprenticeship and quite overbearing in terms of coaching, but she lets you get on with it. She understands obviously that I work in an acute hospital and that sometimes I have to prioritize my caseload within the hospital. So she's very understanding, she's supportive, she's come in to observe me and she's given really good feedback. So yeah, no, it's been really good so far.
Really, really awesome. Yeah, Kate's lovely. She's a colleague of mine. So yeah. Could you talk to me about what kind of impact has this apprenticeship actually had on your work and like on your development?
I'd say it makes me more mindful of what I'm doing kind of at any point in time within the hospital. I'm always kind of thinking, whereas my first couple of months before I joined Dynamic and then when I was kind of just in the induction phase, I was working and then the apprenticeship was kind of separate because obviously at the beginning it's a lot of safeguarding and that kind of stuff. But then obviously once I delved more into it, so anatomy, physiology and stuff like that, I can now actually apply what I'm doing on a day-to-day basis to apprenticeship work and kind of my more clinical side of things. So no, it has been very helpful so far.
That's really cool. Yeah, and do you have any like examples of where, you know, being mindful may have like translated into real life?
Yeah, I think that especially I think it mainly comes down to anatomy and physiology. When I'm seeing patients functionally, I'm able to apply that to my learning.
So, it's really cool. Yeah. Really, really cool. And has this apprenticeship like opened any doors for you, either academically or professionally? Bit of a vague question, I know.
Yeah, no. I mean, it definitely has. It's once I qualify with this qualification, I can then go on and do a degree apprenticeship in occupational therapy. So it's opened up the important door, really. Yeah.
That's really cool. And do you have any idea of like what you want to do after the degree apprenticeship?
I'll probably I'll rotate as a band 5 occupational therapist. I'll more than likely stay in the trust that I'm in now. There's no reason to leave at the moment, and then see where I want to specialize. Maybe geriatrics, I'm thinking, but yeah, haven't really decided on that yet, but there's plenty of time. So
That's awesome. So you're enjoying it a lot then?
yeah, no, definitely.
Learning
Yeah.
a lot.
It's a good career to be in, yeah.
And would you have any advice for like other people thinking about doing apprenticeships or starting an apprenticeship?
I think definitely make sure that it is like 100% what you want to do. I know somebody who went on to do the actual degree, and then they kind of halfway through decided, oh, this really isn't for me anymore. And they said they hadn't thought it through properly. So I think definitely make sure it is what you want to do, because when you're in a patient-facing job, you can't half-heartedly go and see patients and practice as a therapist. So I think, yeah, definitely think it through first, but then once you've made your decision, get on with it, I'd say. Just try and get it all done.
Yeah. So yeah, a lot of commitment basically.
Yeah.
So just make sure you actually can commit.
Yeah, no, I think definitely.
And what about for like people who are on an apprenticeship, but they need advice on like overcoming challenges and things like that?
I mean, there was one point during my apprenticeship where I went through a bit of a boost in motivation, and I went to Kate and we spoke through techniques on how to manage it. So chunking your work and just making sure you're organizing your workload effectively. I think it's easy to become overwhelmed, and that can sometimes decrease your motivation. But I think if you just talk it through with somebody who is in the right position to advise you, then you can find solutions.
Yeah, I think that's really good advice, to be honest. I mean, because I've taken an apprenticeship too, and I remember, there can be points where it's like hard to talk about like problems that you're having and things like that, but the moment that you actually do talk about it, things become a lot more clear.
Exactly, yeah.
How do you sort of unwind? What do you do to, relax and make sure that the stress doesn't just overcome you?
I mean, definitely leaving work at the hospital. I know some people, they keep their emails on and they're checking them outside of working hours. I would never do that. I don't touch anything clinical outside of that time. And when I've got my apprenticeship time, I switch off my phone, I take off my bleep. So I'm just dealing with my apprenticeship and then dealing with work. I think just making sure that you separate home, work, apprenticeship is the most important thing, to be honest.
Very good advice. And this next one's kind of a vague one, but take it however you wish. But what makes you tick?
Where? At work?
I guess. What motivates you?
Oh, okay. To be honest, this might sound a bit cringe, but there's people there lying in a hospital bed that need help. So it's quite difficult not to try and do everything to help them out. I've had obviously family, grandparents and stuff that have been in hospital the same, and often seen them not receive as good care as you might want your loved one to. So I don't want to be that person who's giving bad care to another person's loved one. I think that's my main drive. Yeah.
I mean, it makes a lot of sense. What else are you doing it for, if not the patients that you're helping?
Yeah, no, exactly. You can't just be in it for the money, because there isn't much.
Yeah, that's exactly right. So what do you think, in terms of an apprenticeship, what do you think are the most important tools? Now, this could be like, digital tools or like physical tools, things like that, but it could also be, like things like resilience or like, sort of like non-physical tools.
Yeah. I think firstly, obviously, the people that are around you. I'm lucky I've got a very good team lead at work who's always on hand to help me out and advise. And she reads over my work, gives feedback and stuff like that. So I think that having informed people around you who are actually invested in your qualification. I know that sometimes, especially working in a hospital, some team leads wouldn't be as supportive because they're too busy, or like it's a very high stress environment. So to get someone that can make that time for you is very useful. in the same way, yeah, being able to make that time yourself, like I make sure to advocate for myself and say, no, this is my study time. I'm not taking on any work past 1 o'clock. So
Awesome.
I think, yeah, being able to advocate for yourself as well as having a tutor and a mentor that will advocate for you as well. And yeah, patience. I think apprenticeships can take a long time, and sometimes you get to a point where you're like, oh, for God's sake, I just want to be finished with this now and move on. But you have to be able to go through that kind of the whole process, because otherwise you're going to come out and not be as good a practitioner as you could be if you had taken the time and invested yourself properly in the learning.
Yeah, great advice, I think, honestly.
Mm.
Do you have any like stories from the apprenticeship, any anecdotes that are particularly memorable to you?
My observations, I think, when Kate came in to observe me, that was a very kind of poignant experience for me, because obviously it's fine. I've been told, not praised about my work, but told that I'm doing a good job by other people here. But to have somebody from the college come in as well and be able to kind of look through those competencies of my qualification and say, no, you are reaching this. It was just a very kind of, it made me feel more secure in my ability to practice. So I think that since then, I've definitely been more confident.
Right. So do you think almost having a fresh pair of eyes on your work made it more like real? The fact that you're actually doing a good job, it's actually coming from sort of like an objective outside person.
Yeah.
Really cool. That's a good benefit of apprenticeships, actually. That you actually, a fresh pair of eyes on your work can always be beneficial.
Yeah.
So I guess my next question would be, like, how did the apprenticeship actually differ from your expectations of it?
To be honest, I didn't go into it with much expectation. I'm kind of aware that all different places do their things differently. So I didn't have a very fixed expectation. I think that I was glad to find out that they would be understanding of priorities at certain points, because sometimes when you're stuck in, I don't know, a discharge meeting, or you're stuck with a very difficult patient, you don't get that full time. So to have an understanding, you've got a good understanding side in dynamic training, I think, which is reassuring.
That's good. Yeah, it's a really unique thing delivering apprenticeships to healthcare staff. This isn't like a butcher's apprenticeship or something like that, where exactly. you can really schedule your time. Anything can happen, and anything where you're delivering education to emergency staff, you have to, it's part of the job. You just have to have an understanding of the amount of chaotic things that really can happen. So I'm glad you've had a good experience with that.
Yeah, thank you.
Final question. If you could change something about apprenticeships, what would that be?
I mean, this is just a personal preference, really. I work a lot better and I learn a lot better physically and practically. I like to do things on the job. So for me, the more observation and holistically based a qualification is, I prefer it, but that's simply for my learning style. I mean, I'm happy to sit down and write thousands and thousands of words, and we'll have to, but if I was able to change anything, I think that, I'd make it more holistic, more observation based. I mean, I do a practical job. It's not a job that's all written down. It's stuff that I'm doing kind of day to day. So I think that, at some point, hopefully the apprenticeships in healthcare will become slightly more applicable to the way that we do work. But I understand, obviously, the theory behind it as well is completely necessary. So, yeah.
Okay, thank you.